If an older person is getting forgetful, does that mean they have something like Alzheimer's disease or another form of dementia? Or does it mean they have mild cognitive impairment? Stay tuned to find out. Hello everyone. Welcome to Helping Older Parents with Memory Loss, a video podcast series that gives you strategies and information about assisting aging parents who are experiencing memory or thinking problems. I'm your host, Dr. Leslie Kernisan, board-certified geriatrician and the founder of Better Health While Aging, and also of the Helping Older Parents online programs. In today's episode, I'm going to address a frequently asked question, which is this: what causes memory loss as people get older? Now, in a previous episode, I explained that contrary to what many people believe, if an older person has developed difficulty remembering what happened recently, or if they keep repeating questions or statements, that is not normal age-related slowing of memory. And so it should not be considered normal aging. That said, it is fairly common for people to develop memory loss as they get older. And that's because of underlying health problems. And the health problems that cause memory loss or otherwise impaired brain function become much more common as people age. So what are these causes? People often wonder whether it might be Alzheimer's disease or another form of dementia. Honestly, that's always a possibility, in that Alzheimer's disease is quite common, and it's pretty common that memory loss is one of the earliest symptoms that families notice. But you should not assume that memory problems are due to early Alzheimer's or dementia, because there are many other potential causes of brain dysfunction in aging adults. And we don't want to assume somebody has Alzheimer's or dementia without having first checked for those other causes. So let me now tell you about 10 memory loss causes that I routinely check for when I'm evaluating memory problems in an older adult. The first is medication side effects. There are so many commonly used medications that can slow brain function and can cause or worsen memory loss or other thinking problems. A second cause is abnormalities in a person's blood chemistry. For instance, abnormal levels of blood sodium, calcium, or glucose can all affect brain function. Kidney or liver problems also often affect blood chemistry. It's also possible for these blood chemistry abnormalities to be caused by certain commonly used medications, such as blood pressure medications. A third cause that I often consider is problems with hormones, such as thyroid hormones. Now, it's also possible for imbalances in estrogen and other sex hormones to affect cognitive function. That said, this is probably more of an issue for perimenopausal women than it is for my own patients, who are usually in their 80s and older. A fourth cause to consider is deficiencies in vitamins and other key nutrients. Brain function is especially known to be affected by low levels of vitamin B12, other B vitamins, and folate. A fifth cause to consider is delirium. This is a state of worse than usual mental function that can be brought on by just about any type of serious illness. And delirium is especially common in hospitalized older adults or in people who have had surgery. But it can also occur due to an infection or due to other health problems in older adults who are not hospitalized. So that's an important cause to consider as well. Number 6 that I want to tell you about is psychiatric illness. Most psychiatric conditions, in fact, can cause problems with memory, thinking, or concentration, especially in aging adults. Psychiatric illnesses can also cause paranoia and other forms of late-life psychosis. Now, in older adults, depression and anxiety are probably the most common psychiatric conditions we encounter. But it's also possible for older adults to have bipolar disorder, schizophrenia, or other forms of major mental illness. Usually, these will have been diagnosed earlier in the older person's life. Number 7 that I want to tell you about is substance abuse and/or substance withdrawal. That's because either acute intoxication, so being currently using the substance, or chronic overuse of certain substances, such as alcohol, illicit drugs, or even prescription drugs, that can often impair brain function. So it's important to check for that as well. Now, number 8 is really a big one, and that is damage to brain neurons due to an injury. And probably the most common form of damage is vascular damage, which means damage caused by injuries and diseases affecting the blood vessels. Most people have heard of major strokes and know how they can affect the brain. But what's by far more common is for the aging brain to be affected by something we call cerebral small vessel disease, which basically means injuries or diseases related to the very small blood vessels in the brain. Over years, these accumulate in almost every older person, and in some older adults, they can accumulate to the degree that they actually start to cause problems with brain function. This is sometimes called vascular cognitive impairment and can potentially lead to vascular dementia. Another type of injury to consider are head injuries, which can also be associated with temporary or longer-lasting cognitive impairment. But I would say that vascular injuries are much more common. Number 9 on my list is infections, and this is not as common in older adults, I would say, as the causes above, but certain chronic or acute infections, either viral or bacterial, can affect brain cells directly. Now you might be thinking, hold on a moment. I've heard that urinary tract infections or other infections can potentially cause memory loss or confusion. Now that's true, but I would say that's more due to delirium, and it's less about that infection directly affecting the brain cells. And now for number 10, last but not least, is neurodegenerative conditions, which damage brain cells over time. These include Alzheimer's disease, Lewy body disease, Parkinson's, and frontotemporal dementia. And because these conditions slowly damage brain cells over time, usually years or even decades, they often progress very slowly and can start by causing mild cognitive impairment, which then progresses to dementia. And when we say it's progressed to dementia, that means that the memory loss or thinking problems have gotten bad enough to affect independence in daily life tasks. If it hasn't gotten bad enough to affect independence in daily life tasks, but there's definitely some memory loss or other cognitive problems, we would call that mild cognitive impairment. So those are the 10 causes that I think about for memory loss in an older person. Now, if you've been worrying about your aging parent or another older relative, you're probably thinking, okay, but what's causing my parents' memory loss? And could it be reversed? Those are great questions, and I want to encourage you to keep thinking about them. To answer those questions, your parent is going to need to get medically evaluated. If you want to know more about what that medical evaluation should cover, I have another video that covers this topic in depth. Or you can also find this information in my book, which includes a handy downloadable cheat sheet related to evaluation. You may also be wondering how to actually get your parent to the doctor or how to find out what type of evaluation has been going on. This can be tough because if your parent's been having memory loss, they might not remember, or even more common, they might be reluctant to tell you. But don't worry, that's what I'll be covering in upcoming episodes, so be sure to subscribe, or otherwise stay tuned and I'll be seeing you again soon.